So, dear all participants, can you all hear me? I can see one of the comment in the chat box you cannot hear. Can you hear me now, Ms. Pramila Jyoti? Yes, thank you so much for the acknowledgement. Good afternoon, everybody. So let's start our Friday webinar. Welcome you all. Welcome, dear all participants who have logged in by time for attending to a Friday webinar. I know today it's going to be a really interesting session, which is on compassionate leadership in nursing, leading with heart and purpose. And today the theme is basically on inspiration and insights from nursing leaders. And before getting into the actual session, I just would like to take you all through the quick introduction for the benefit of the newcomers. About us, we have been established since the year 2018, and our commitment is purely to provide the comprehensive training programs to all the healthcare professionals and to enhance their capabilities and to uplift them, and especially for the nursing professionals to move from the bedside to the admin level. And for now, we have 10,000 plus healthcare professionals who have got benefit out of us, and 75 plus hospitals in network with us, and 50 plus topics have been launched. And with that 10,000 plus nurses, I welcome you all the newcomers who have not been into our community. Please join us and get benefit out of all our course programs. And coming to the skills format learning pyramid, what is this logo actually speaks about? So for all of you, like it is like we have a ladder kind of pyramid, which has 4 stages. The stage 1, it's actually about the service excellence skills. The one professionals who entering into the healthcare system does need basic things like to survive in the healthcare it is about. So for example, we cover the program like infection prevention basics and communication, professionalism, and about the etiquette. All those things are covered where the healthcare professional after attending to this program will be eligible to survive in the healthcare sector. And once it has been achieved, moving to the stage 2, what is it about? Is about core patient care skills. That is actually about entire bedside procedural skill. You mean you would have heard term called competent. Competent in a sense, excel in one particular area. We want all the nurses to be called as a clinical expert, where he or she will be competent in all aspects of the procedural skills. After becoming a clinical expert, it's not a stop for you all. You can move to the stage 3, where you have to identify your own specialty, or you're already into a specialty. You can deep root yourself by deep diving into the course program. For example, you are in the labor room. We have the labor room upskilling program, ER upskilling program, and entirely a different wing called as infection control nurse, which is a huge responsibility. And we have infection control program, which is collaborated with 𝐂𝐨𝐻𝐿. And also we have the clinical instructor program, where the nurses have feel like stagnated in the same position after 10 years of period. They can transform themselves as a clinical instructor. And stage 4, this is actually we are talking about the nursing leadership journey, and we have 2 pathways, which is the vertical pathway and the lateral pathway. Vertical pathway is about where you will become a staff nurse, senior staff nurse, in charge, supervisor, ANS, DNS, and CNO. and that's called the vertical pathway. So let us think about that is actually a nursing leadership pathway. Let us think about another pathway which you have, that is actually a nursing management pathway. That is a lateral pathway where you nurses are capable to do all streamline of works in the healthcare system, where you can transform yourself as a CEO of the hospital when you take a lateral pathway where you have to initially jump into the operation administration side and then grow yourself as a CEO of the hospital. This is a two pathway which is taught in the stage 4. So this is all about the skills for my learning pyramid. And I have an announcement. This is about the infection control nurse course program, which is skills format collaborate with the 𝐂𝐨𝐻. We are giving this program. This is a self-paced learning. We have seen a lot of nurses who have completed this course program and transformed themselves as an infection control nurse. And these course highlights are comprehensive, and the offer price is running right now. You can see on the screen, and even you can register for this program. To know more about our course details, you can contact the number on the display. She is Miss Jayanti, our admin manager, and also you can visit our website www.skillsformed.com. So coming to the today's session, so it is being kept as a surprising element. Who is our speaker? So our speaker, like, we are honored to welcome Dr. S. Kanchana, who is RN RM, MSc Nursing, and PG Diploma, PhD in Nursing, and also she have completed a postdoctoral program in the research, and an accomplished nurse educator. She's a researcher and academic leader with over 28 years of experience in nursing education and community health. She currently serves as the principal of Omayal College of Nursing. Most probably, she would have been a known, leader among everybody who all there now attending now. And also, she is a research director at the ICCR, International Center for Collaborative Research in Chennai. She holds a PhD in nursing, and then I have already informed you she is a postdoctoral fellowship from Queen Margaret University, UK, and has made significant contributions to nursing research and curriculum development. And Dr. Kanchana has mentored undergraduate, postgraduate, and doctoral students, published extensively, and organized numerous national and international conferences and training programs. Her areas of expertise include research, academic leadership, public health interventions, and primary healthcare capacity building. And her pioneering initiatives include the establishments of PhD program, NCT kiosks in rural areas, and nurse-led outreach models. She is the recipient of multiple awards, including Best Teacher and Lifetime Achievement Awards, and has represented her institution in various global research collaborations and conferences. So please join me in welcoming our today's speaker, Dr. S. Kanchana. And in addition to that, I would like to tell you all that she is one of our advisory board committee member, and proud to announce that here, ma'am. Welcome you, ma'am. And today's session will be equally shared by Dr. Parivalvan Rajavelu. He is highly respected consultant surgeon in Sundara Medical Foundation, and he is the visionary founder of Skills for Med. And as you have all know, I have introduced about our Skills for Med platform, and he is the person who is behind this empowering nurses and healthcare professional journey with the high quality with a strong focus on patient safety and clinical excellence. He is a passionate advocate for healthcare quality. Dr. Parivalvan plays a key role in the 𝐂𝐻. He contributes as a mentor, national speaker, GC committee member, and serves as a chair of EndoSafe, actively promoting endoscopy safety across India. His leadership is deeply rooted in extensive clinical expertise and ongoing research and international presentations. Through Skills for Med, he contributes to advance healthcare outcomes by equipping professionals with real-world skills and practical knowledge. Dr. Parivalvan's unique blend of clinical skill, academic rigor, and systemic level thinking makes him an inspiration and change maker in today's landscape. So please join me in welcoming Dr. Parivalvan Rajavelu. Welcome you both, and waiting ahead to look forward about today's session. Thank you both, and ma'am and sir can start your interactive sessions with you have questions to put forth to Dr. Kanchana. Welcome you both.
Thank you, Stella, for the introduction. Thank you.
Thank you, Swapna.
Thank you, Stella, for the introduction. I'm really glad to have Dr. Kanchana here. Can you stop sharing your
Yes.
presentation?
Yes.
Thank you. I'm now Dr. Kanchana and me go a long way back. Welcome to this session. So we have now in my capacity as a surgeon at 𝐍𝐮𝐫𝐬𝐢𝐴 Medical Foundation, and also as a founder of Skill Summit. I've interacted with her for several years, and I know that she's one of the foremost academic leaders in our country. And Omayal Achi Nursing College is known all over India for its reputation as being one of the top colleges in the country. And she has been leading it for so many years. So thank you so much, ma'am, for coming and joining us.
Thank you for the opportunity, sir. Thank you.
Sorry to interrupt, sir. I'm really very sorry. Ma'am, can you give us a better lighting, ma'am? We are not able to see your, because, yeah, I think some problem occurred in your lighting.
Spectacle.
Yeah,
okay.
no,
Yeah,
that's
yeah.
better. Yeah, thank you.
Yes, ma'am. So powerful. Thank you so much.
All right. So now my first question to you is about your journey, in the nursing and your progress to becoming a leader. So I'm sure that itself will be an interesting story. So once you tell us that, then we will take it from there.
Thank you, sir. I'm a person who chose nursing by choice. It didn't come by chance because I've heard about stories of how nurses work at hospitals from my sister who was studying nursing and working thereafter worked as a nurse at CMC Vellore. So for every vacation when she comes down, she used to share stories about her being a nurse and how proud and how satisfying it is to be a nurse back when she was doing her nursing at CMC Vellore. So this brought in a lot of inspiration in me that I wanted to pursue nursing, though I was not much of a science liker of biology and all, but still I forced myself to take biology because that's the only route I can enter nursing. So that's how, when I did write my entrance for CMC after taking 3 months of training to write the entrance exam at 𝐻𝐮𝐫𝐬𝐢𝐧𝑠 College at Vellore. But later, my destiny took me to Ramakrishna Institute of Paramedical Sciences at Coimbatore, where I did my 4-year BSc Nursing degree program. I think my base started there. The foundation for my subjects was given by St. Joseph's High Secondary School and the Government Girls High Secondary School, where I did my +1 and +2. But from the base from there, Ramakrishna built the leadership skill in me. They gave me the environment. I was not very well known. It was not in the forefront during my schooling, but during the college, all positions what could give leadership qualities was given by the college and the recognition. But the challenges also put forth in front of me as a student leader was also there, where I groomed myself not only as a professional but also as an individual person. So the values, the ground values where I learned was from Ramakrishna, and I'm sure my principal, Dr. Sita Lakshmi, she was a very, very, very strict person, and it was always a joy to be there making all the naughty things, but still there doing my work to do the study. So that's how BSc 4 years in 1992 to 96 I did, and came back. While I live in Chennai, Ambattur, where Omayal Achi was situated just about 4-5 kilometers from my home. So the choice of my parents was to join somewhere nearby. So that's the reason, because we had a textile business which was running, and I had to manage both. So that way, I was led into Omayal Achi College of Nursing, and probably that's where all about the passion towards nursing as well as education, both where that amalgamation happened at Omayal Achi. But I was, life was very tough and challenging personally, I took the choice of, taking the opportunity to take a sponsorship and do my master's degree. And Omayal Achi College of Nursing Management was very, very graceful and magnanimous in giving me the scholarship to do my PG program, without which I couldn't have taken up the PG program at that point of time. So the PG program, and I specialized in community health nursing because I developed a passion towards primary healthcare from my second year of BSc nursing program, where most of the community skills, the NSS program, and all the volunteering work which I do was related to public health and primary healthcare and population health. So that's how the community health nursing interest came in. And my 2 years of program at Omayal Achi, which has a nurse-led community health center, gave me all the options of, creating a passion or a pathway or leading a pathway towards primary healthcare scenario.
I
So
think that's
19
where
to
I
2000.
met you initially, I
Yes,
think.
that's where
Yeah.
I think we met. And as I took over as an in charge in the year 2000, 2001, that's when we had a collaboration with Sundara Medical Foundation. And it was it was like a dream come true to be with the people, to work with the people. And the collaborators who came into Omayal Achi Community Health Center made it even more interesting because we were able to do deliveries there. We did very small, minor surgeries. We had an OT there. We did minor surgeries with the help of Pari sir, Alfred sir, who came in. ENT specialty clinics were there. So all this was made a reality, and the primary healthcare perspective led into identifying what people want. So the need. So the base or the foundation came in identifying the need and providing care. I think the vulnerable population, the population who really were marginalized, were given the opportunity for healthcare services through Omayal Achi Community Health Center. So that, as I took over the in charge in 2001 to 2006, I was in charge at Omayal Achi Community Health Center as a public health nurse. And overnight, for the need of the institution, I was then appointed as a principal at Omayal Achi College of Nursing in
Okay.
April
Now,
2006.
before we get into that part of the
Yeah.
journey, I want to ask a few questions. I mean, I was really, fascinated about you telling the foundation, the college, the not the actual nursing college, but actually the +1 and +2 gave you in terms of leadership.
Yeah.
And so I've now had similar experience even from school because I know our school was probably one of the very famous ones when I was studying, whereas Christian College High School in Chennai. And they had this program called Volunteer, where we
Yes.
could actually be leaders to our not only the class but for the whole school. Overseeing um, latecomers, especially we could make
Yes.
them do sit-ups if they come late, right? So this, I mean, that apart from the fun part, I think these small things which the schools and colleges do actually makes a lot of contribution. And I
Yes.
feel over the years that has actually been diluted in the name of academics. What is your thought on that?
No, I completely agree with you because in my high schooling, I was a part of the Bulbuls. I was a part of the guide, the movement. Then in +1, +2, it is the NSS volunteership. Apart from that, from fifth onwards, I used to volunteer for the dumb and deaf school and the blind school to do the volunteering work on every Saturday and Sunday. So all these and probably the availability of these organizations in the school and opportunities given by parents to be a part of the school and the motivation given by the teachers to take the lead in these organizations, I think make a lot of difference to shape a person how they want to be and how they want to lead. So definitely these, as you said, I completely agree with the concept of this volunteering in the very early ages would definitely support a person to be what they want to be, achieve their goals, achieve their visions, and in a more better way. So that way, I completely agree with you, sir.
Right. Okay. I think you should tell your story as being the principal and where
Yes.
you are now. I think it's a fascinating experience you had. And also, no, the amount of responsibilities now you have, and I heard several people telling that you just execute that at each. How did you sort of learn all these things, or how did it actually come about?
Actually, during my experience, the years of experience at 𝐻𝐸𝐻𝐸 Community Health Center, it was more of an experiential learning, and experiential learning in not only with the people in the community, but also many collaborators where we, along with Rotary Club, we were with the Shankara Eye Hospital, we were with the Lions Club, and very small organizations in and around the health centers. I think that built the communication ability, the coordination and collaboration ability in me, and able to give an orientation to the n number of visiting guests who came into the health center to have a look at the center, and their sharing of knowledge, what knowledge they shared with me about their experiences back home, not only from India, but various other countries, especially with the University of Saskatchewan, Canada. Dr. Vivian has been a very important influencer in the area of primary health care and the importance of community engagement and research. So that way, the management of Omayal Achi College of Nursing gave the freedom to a nurse to plan, organize, and execute programs in the health center. So I think very early stages itself, we started doing, in 2001, we did the polio rehabilitation camp. And in 2002, we understood the need for creating volunteers in the community. So we started doing a village health empowerment training program for the people. And during those days when we didn't actually have any volunteers or when we have any reach out to the community, the volunteers whom we trained and prepared were the liaison officers who brought in the connectivity between the professionals and between the community people. So they acted as a peer mentor. So all these experiences gave the base for developing our own skills, our own leadership skills, and probably with all the amount of groundwork what we have done. So getting into completely shifting from the primary healthcare component in 2006 to as a principal was a very challenging point, because my role in academics was with the student. I used to come, take class, give them an evaluation and report the evaluation. And we used to do a lot of counseling with the students. So that and mentorship was done. That's all I have done with related to academics. Planning and executing academic plans was something way difficult for me, because that was not my cup of tea. So it was challenging, but I had an excellent mentor, Dr. A.V. Raman, who was there as a dean for 2 years. Probably every letter, how to read a letter and how to mark important points within a letter, how to acknowledge, how to respond. I think Dr. A.V. Raman ma'am has made a great influence in me as an administrator. And my colleagues, Professor Rachel, Dr. Rachel was there, Dr. Reena was there, who were the vice principal of academic and admin. Actually, they knew more about academics than me. So I took it an opportunity to learn from them. And it is they who taught me academics, academic planning and execution. So I always say that I learned from my colleagues of how to do the planning. And apart from that, we had Dr. Rajnarayanan, who was, I'm sure sir knows Dr. Rajnarayanan, who was our mentor, and a person who believed and who taught all his life, though he was an MBBS and an FRCS, but all his life he was teaching nursing at Omayal Achi, nursing students at Omayal Achi. So our inspiration towards being a humble teacher, to be an humble teacher, to be an approachable teacher, and the importance of, every class, he used to spend 10-15 minutes just communicating freely with the students. So beyond the classroom teaching, it's important to connect with the students and to connect with your people in the class. I think he made a lot of difference in making us understand. Being a PG student, he was my teacher there. And after that, every lessons what we used to sit and discuss, he gave a lot of influence, and he believed that nurses are the cornerstone or the core of healthcare industry. And he made us believe that research by nurses will make a lot of difference in healthcare industry. And every student, from the very first year to final year, should get involved in research. And that's how, under his guidance, Omayal Achi and Dr. Vivian's guidance, we collaborated in starting the International Center for Collaborative Research. So our healthcare service was under the wings of Community Health Center, education under the College of Nursing, and research was developed and facilitated under the International Center for Collaborative Research, where he was a mentor for research in nursing at Omayal Achi. And we have achieved so many things and so many milestones under his
I'll
guideship.
stop you there,
And he
Dr.
believed that,
Dr.
yes,
Kanchana, I'll
yes.
stop you there because I think there are several points I want to emphasize in what, from your journey. I think people, should know that. I think, you've been talking and I want to highlight that. The first is, empowerment given to nurses. I think the empowerment your institution gave you made all the difference. That's number one. I think,
Yes.
something which is a fantastic takeaway. And the second is the collaboration and cooperation which you go out of your routine job. Now, you could have just run the primary health center, but the amount of collaboration, not only with the community, but with various organizations like Sundara Medical Foundation internally in India. And I remember people from Saskatchewan, I always have difficulty in pronouncing this, Canadian University. Because of Omayal Achi, they came to SMF as well, and they were talking. Imagine the experience of, I still remember this boy who came from this university. As I was sitting and talking in a room, the current went off and my room was plunged into darkness. He panicked. He's never seen darkness in his life. And that's sort of people coming to Omayal Achi, spending that room, you giving the experience matters. So the second thing in leadership is going beyond your area of comfort and extending your services to the other organizations. The third is having mentors. Now you cannot get away from that. You had such fantastic mentors which you mentioned, and it is so in fact you sort of stole my next question. I was supposed to ask about the mentors, but you already mentioned that. So the third is having mentors. You should find your mentors. Just like, you are finding the right books to read, you should go and seek out your mentors. They are the most important people in your life. And if having the right mentors actually makes a difference. And the fourth point I want to mention is that, even though, you were in education, you went and had this background in community, the research aspect of it. And I know your institution probably one of the few nursing colleges who actually published a book on nursing procedures, with an international publisher. So there are so many facets which you have explored and that has given you. And the final thing I wanted to talk about is the humility and humbleness and approaching the students, in a very, not just as a teacher, but as a mentor and actually as a second parent. I think that is what I found in you, and I thought I'll highlight that to the audience. So I want to go to, the next question because for lack of time. What are the, I know you had a lot of, opportunities, but what are the important challenges and barriers in your journey, and how do you overcome them?
So, the major challenges which I faced, let it be the primary healthcare sector, is building trust with the people. So unless you have ground level engagement, unless you take the right pathway to engage, the community health work would never happen. So the community engagement, and it's not only community engagement, it is organizational engagement, it is student engagement or building trust is something was very, very challenging. And but that is the foundation. And if you spend most of your time or experience on it, once you build that, then everything grows on its own. So building trust and engagement took a lot of time, but it definitely gave us the outcome what we wanted to. So that one of the basic challenges which I faced was identifying areas for engagement. And the other challenges is, again, wherever there's a lot of difficulty in gaining recognition for nursing and respect for nursing. Beyond the financial implications, it is the challenges here is when our students come and ask, we study so much, but what is the recognition and respect we get at the even in the healthcare industry by our own healthcare fraternity? So that's one of the major challenges which we are still facing. And I'm sure a lot of visibility for nursing has come forward, and we hope to go forward with that visibility. So gaining that recognition and respect needs a lot of command over knowledge, the competence. So when we want to gain that respect and recognition, our command. So I always tell our student nurses, and I would gain that knowledge, have the best amalgamation of the knowledge, skill, and definitely the attitude and values. When that is there, automatically the command and respect is going to come to us. So that foundation is very important. So that is a challenge. And with all the digital transformations which are happening, so I think keeping everything on a check is also now a big challenge, and how to get this digital literacy across in a very positive way to the students is what we are now looking at.
Right. I think the challenge of recognition still remains. I think it's a huge problem
Yes.
in our country, and that's what Skills Summit is also trying to do. But I think you're an example, and I think you sort of pointed out a very important aspect that you need to be in command of yourself. And that command will come with you seeking out more knowledge and increasing your competency. So I feel both have to go to parallel. I mean, we could do a movement to bring recognition to the nurses, but the nurses themselves, I feel, have to wake up and do that extra work to increase the competency. So what do you think are the ways in which they can do apart from doing traditional courses like BSc and MSc and maybe some diploma?
Yeah.
How could the nurses actually build their competence and skills?
Actually, it's important that they speak up, they be assertive, and it's very important when they are in the midst of a healthcare team that nurses are able to voice out. And if it is wrong, they should know, they should have the courage to say it is wrong. And when someone says that what we are doing is wrong, try to accept the positive criticism and learn higher, so that learn or improve ourselves in those areas and equip ourselves in that area. So I think the first thing is courage, what nurses should have. And that courage or that assertiveness, very, very important is assertiveness, which I feel apart from all the values of compassion, all which every nurse has been, that's a foundation where they are built on. But assertiveness is something which our students from the very first year, we always, when they speak up and ask questions, we ask them, why you're asking this question? It's not relevant to you, so don't ask this question. So the art of questioning itself has gone among, and they are just listeners. They just listen, they just hear, and they just write their exam. So somewhere the overall professional development or the value development, assertiveness development, leadership development, all these are important in the curriculum itself. Though it is not directly linked in the curriculum, but institution should take responsibility to build these skills within the curriculum as they transform from the first to fourth year.
Yeah, that's correct. And I just wanted to ask this sort of question that if you already said you took nursing by choice, so I don't think this question is superfluous. But suppose you could rewind your life and start all over again, and what are the aspects you would do differently so that your leadership skills and you had a lot of opportunities, but audience for a person who's just finished the nursing, what are the things they could do differently? What you do differently?
I always aspired to be in the field. So my interest was in the field, to be in public health sector. to be with the people, to work, believe more in prevention and primary healthcare aspects. And because there are so many people who need us, where there is a corporate world which is booming on one end, there is a group of people who really needs even basic information on health and health literacy. So I would prefer to stay in the field. I would, if you give me a tune back to 25 years before now, 20 years of principalship now. So before that, probably I would stick to being as a field in the field, and also to lobby for nurses towards a recognition. So I would love to be a nurse activist though.
Right. I hope, with your advice, Skills Summit will do that. And what I wanted to know, one last question. You were talking about digital literacy, and now, in addition to digital literacy, we can now have AI literacy, right?
Yeah.
Artificial intelligence literacy.
Yes.
And we are still struggling with digital literacy. And AI is sort of growing so fast. I mean, people do not understand the impact AI is going to have in our lives in the next 2 to 5 years. It's just you can't even imagine. Our human intellect can't even imagine how our lives are going to change. How do you think in colleges this can be inculcated to these students, to the future generations?
AI is definitely going to have, it's from my perspective. So I'm not an IT person, but still with this few informations and some knowledge which I have on artificial intelligence, definitely it is going to give you a lot of scope in identifying better opportunities and avenues for nursing. There is no doubt about it, but it cannot replace a nurse in any sector, in a caring sector where human touch becomes very, very important. And without compassion, care is not feasible. So all that is going to be there. But to students and to the nurses, we need to learn. We should learn AI. For one reason is we should know where to apply and where not to apply. To that literacy level, at least artificial intelligence is something which we need to learn. And ignoring telling that, no, I don't know, is not an excuse for nurses not knowing the newer technologies. So for students and for our nurses also, that literacy has to be given, and by workshops, or you can have speakers who can come, webinars. So there are many opportunities, and now it's available online. So it's important that nurses know AI to know where to incorporate it and where not to, where it can be limited utilization.
Yeah, I think that's going to be the challenge, and because it's a double-edged sword, as you pointed out.
Yes.
You can use it correctly. It's like fire, actually. If you use it correctly, it's going to help you. But if you use it wrongly, it's going to really hurt you.
The
And it's a
challenge
very,
now we
very
have is, sir, if you put a question, the AI gives you the answer in bullet points. But are students learning the whole pathophysiology of that disease, or the nursing care of that condition, or the surgical management of this condition? Do they know? That becomes a big question. They can definitely write the exam and get the marks on the degree certificate, but how much of the conceptual learning is happening becomes a big question. So that awareness, I think we have to tell them that phenomenal learning, the conceptual learning is very important in nursing and any healthcare industry. Yes.
Yeah. Thank you so much for those insightful answers and sharing your experience. We're really looking forward to your presentation on compassionate care. I think that's a very, very, it's actually become old-fashioned to talk about compassion and altruism. Now, I recently wrote a post on altruism in LinkedIn, and someone comment was that it is an old-fashioned term, but I think it's very, very relevant actually now, as you told, in the context of AI and other digital things coming in. So really looking forward to your talk. Thank you so much for sharing your insights and your journey. Thank you.
Thank you, sir. Thank you so much.
Stella, you can take over.
Yeah, yes, sir. Ma'am, you can share your screen, ma'am.
Yeah, I will. Yeah.
Yeah, yes.
My screen visible?
Yeah, visible, ma'am?
Yeah.
Yes. Yes, ma'am. Please go ahead.
A very good evening to the virtual audience out there and my nurses, my colleagues, my friends. It's a joy to be always sharing knowledge with our fraternity. And probably this choice of topic was given to me. They gave me certain choices, and I chose compassionate leadership in nursing. The reason why I chose this was nursing being a female dominated profession. They are multitaskers, and I believe that there's a lot, there is so much behind the professional. There is a person behind a professional. Behind every professional we see, a nurse we see, there is a person who's hiding behind that profession. It's important for leaders to look behind and see that person who makes or hides many things to achieve the purpose for why they are serving in the field where they are, either the hospital or the education sector or the primary healthcare sector. So as a leader in an organization, if you want this person to be satisfied, to be giving you a compassionate care to the patients who are coming under your organizational care, or you believe, or you want that person who is there, who's helping you to achieve the organizational goals, should they be happy is a big question which as leaders we should ask. So as we want them to be satisfied, we want the productivity to be more, and we want them to provide the compassionate care to the patients whom they serve. As an individual born in a joint family, compassion is something which we learned from our very, very younger ages. And I always believed that people are more important than tasks. In the current world of rat races, of achieving targets, of achieving quality, markers, of achieving the percentages or rankings what we have under accreditations, I think there's so many people who are working together as a professional. But if as a leader in an organization, it is our duty to look beyond that professional and see who's standing behind and be in their shoes and help them when they are in need. So compassion is not about toxic affection or personal biases which we show in an organization, but compassion is something what we identify their need when they are in distress and giving the right concern and the right care and help when it is required. So I believe that this topic in the current day scenario where people having people within your organization, having the retention of people in the organization is becoming a big challenge in the hospitals, in the healthcare industries, in education institutions. And why retention is not happening in many places, there are many reasons. A survey was done among nursing leaders, and they asked a question, do you really need compassion when you are working or when you are leading a group? 91% of them said, yes, compassion is something, a priority, but 85% of them also said, we are not aware of how to show that compassion while we lead the group or while we lead the team. So though leaders know that compassion is very important, they don't know how the right compassionate leadership should be provided to the teams. So here, the major question here, what we are looking at is how to provide this compassionate leadership and how to lead a team with a heart and a purpose. So leading a team with a heart and a purpose is to achieve the goals of the organization. Ultimately, it is achieving the goals of the organization. And that's what we are looking at And I bring greetings from Omayal College of Nursing, which was established in 92. The International Center, which was established in the year 2008. You can reach out to us on our website. And also the Omayal Community Health Center, which was established in 1998 and providing services to nearly 21 villages right now. So this is the first picture, shows about the brain and the heart. It is a head and a heart. Our competencies, our skills, and the care from our heart with the skills of the leadership will help you achieve the goals of the institution in a very positive way. If your employee is happy, if your people are happy within the organization, definitely you will see the productivity which is going to be double-fold. The care what they give, when they are happy, the care what they give for the patient is happy. When they're happy, when they lead the team is going to be happy. So what is required here? The head and the heart are very important for critical application of the skills of the head and the heart in the right time when your person, when your teammate or when your colleague or when your mentee requires it in an organization to achieve your goals. So this is a small leadership pathway. If you can see the serial number 1, 2, 3 on your left here, says weaken the power of the rat race magnet. As I was telling, first of all, the theory of this unfreezing, freezing and refreezing is what I always say for an easy application of anything. When you want to be a compassionate leader, see what are the attitudes that we have to release from ourselves. A release from ourselves is you are achieving targets. If you're only achieving targets on paper, then we are not doing the right thing for the organization. Only if you achieve targets by providing meaningful care and quality care to the patient who comes under your organization or for the students who come for your academic learning, we are then doing the right thing as a leader. So here you unfreeze, that is weaken the power of the rat race magnet by releasing the stress, by getting centered on what you actually want to definitely look at for achieving and solve problems through your relearning of concepts of how to achieve your targets. The second is improve relationships. Organization requires meaningful relationships, meaningful connections for a purpose. And if the team keeps fighting or having conflict all the time, as a leader, you'll have to do conflict resolution most of the time instead of achieving meaningful solutions or purposes for the organization. So here, first of all, as a leader, we should detect our own strengths, our own weaknesses. What are our own strengths and weaknesses as a leader? See the world from others' perspective. We always say the story from our side. Your person, your colleague, you're another nurse in the organization, your senior nurse, you're in charge, or a new novice nurse who has joined you, have another world of their own. So as a leader, it's not enough if we see what's there from your end or what you want, but you must also see what is there for them to achieve what you want to and how to build that relationships meaningfully. So connections have to be made meaningfully if you want to achieve the compassionate leader pathway and you want to become a compassionate leader. So discuss you discover your protective plan so that you create a room for growth. So we have unfreezed. We are freezed with improving relationships. Now we have to refreeze is where you keep growing, where you practice that growth, sustain the growth, and enjoy the freedom of being a leader in an organization. This leadership is going to be a sustainable model where you can achieve what you want to achieve for the organization. So what is the compassionate leadership? Now I'm going to ask most questions. So probably you can also ask yourself those questions. What is compassionate leadership according to you? If your nurse in charge comes and say, I'm very concerned about you. Did you have your breakfast? Is being nice. It's just being nice. But compassionate leadership is going beyond that being nice. Being nice is not compassionate leadership. Being nice is being just a good human being. What is compassionate leadership then? You want to do hard things, how to do hard things in a human way. Complex things, achieving your quality markers, quality outcomes. Those are complex things. Caring for a person in an ICU who is an unconscious patient, but caring with concern and compassion. That's a hard thing. But how is this nurse going to achieve it? So if you want to achieve those goals, it is a hard thing to achieve, but always use the way of humility or the human way of achieving. And that's what compassionate leadership is about. Using your head and heart to inspire and influence others. As a leader, that's a great responsibility. You just can't go work, finish my job. I've signed these papers. I've given my reports. I've uploaded this. That is not what leadership is. That is just a reporting. That's an accountability you are doing. Leadership is going beyond that. Use your competence, use your skills, use your heart to inspire and influence people who are there in your organization. Inspire them to become a leader, inspire them to become a compassionate nurse, inspire them to become a good team worker. And thereby, they will provide this positive vibes within the organization to influence the team as a whole. So we as a leader should know the struggles of your own person and see that you are there during the struggle and provide them with care so that their well-being is taken care and the growth is there. There's a small, simple, very simple example. I'm sure many charge nurses would be there, or shift nurses would be there, or ward in charges would be there. When a new nurse comes and joins, even for a small injection or dressing, many students come from various institutions where institutions have, there are so many things which are questionable, not going into that intricacies, but even to do a simple dressing, the nurses who are joined as junior nurses who are just joined about a day or two, given a procedure to do dressing, they are overwhelmed to do it. They are very anxious to do it. So a charge nurse who's there or a leader who's there as a shift nurse or a ward nurse comes into the rescue of this nurse. And she says, holds a hand and says, see, this is how you have to do. Go about doing this. This is the first step. Do this. This is the second. And she actively participates and engages in the process of doing the dressing and gives confidence to that new nurse to do the dressing. But that doesn't stop there. The charge nurse doesn't stop there. She later asks for, creates a debriefing time of 10 minutes and try to sit down and understand what is actually crossed that overwhelming. A nurse who's finishing a final year and joining should be very skillful in doing a dressing with all the procedures, because that's what is being assessed in the university examinations. But what is the root cause for her anxiousness? Is she anxious because she's a new person, or she's anxious she doesn't know the policy of the organization? So you understand the root cause why the nurse got anxious. And by that, this charge nurse goes beyond the professional and sees the person who's behind the professional to understand what causes this overwhelming and tries to do a solution and provides a confidence for the nurse to continue. If not, the next day, this nurse will never turn back to the hospital. It has happened and it will happen definitely. So that's a scenario. But if you want our nurses to stay back in the profession, continue in the profession, they need a lot of hand-holding when they join immediately. I think leadership skills is to see that person behind that professional. Now, to the audience out there, let me just ask you to reflect on one act of compassion you practiced in the last week. Probably you can put it in the chat box and let me know one act of compassion that you as a person practice for your colleague or your student or your senior, whoever it is in your organizations. So you can put it on the chat box.
Yes, I'll read out, ma'am. I'll read out. I'm here. As ma'am said, you can put one no act of compassion what you have done in the last week. Just put in simple sentence or simple word like what you have done.
Empathy. Yes.
Empathy. That was the first one.
Yes.
Empathy. Yeah. Then good, Miss Chandrakala, and all the participants. Yeah, patience.
Okay. Probably I can even reword this. Being kind. Yes.
Yes,
Patient.
yes, ma'am.
Exactly.
Yeah.
Yes. Right. Trust and talking. Yes. Being humble. Very good. Okay. This is what you practiced. Can you write one act of compassion that you received from a leader in your organization? Anything you received from an organization? Okay, offering engagement, encouragement, understanding, guidance to novice nurses, calmness, very important one. Okay. Okay, you received comfort, Shalini, or guidance? Yes, okay. Yes, you received guidance from your leader, empowerment from your leader. Okay, they listened to your problems and supported. Okay. Motivation you received. So we have very good nurses who are leaders who are already, practicing compassionate leadership out there, mentorship, supporting the
Yes.
team member. Yeah. So thank you so much for being so interactive and giving a lot of inputs onto it. I think these are all what qualities of a compassionate leader. What all you mentioned are some of the qualities of a compassionate leader, and that makes my job easier when I need to explain. So why it matters? Why compassionate leadership? So sir was telling, you're talking of altruism. It's a very old school of thought. Compassion, when we say, you keep saying this from the very first year, and we that's what we are doing in nursing. Yes, in leadership, compassion has matters very, very important, because the people who are working for you, working with you, working for the organizational goals, they go through a lot of storms meaning challenges. And they have to take perfect solutions for those challenges. The very most difficult task beyond just challenges, they have to identify solutions, very important solutions for these challenges. The leaders here have to understand that in government hospitals, you go 50 beds, one nurse. It's not a very uncommon scenario. It is a very common scenario what all of us are facing in the governments now, even in Indian scenario. The emotional labor that every colleague of yours, every nurse of yours in the organization undergoes. The dealing with diverse and often distressed families. So in this 8-hour or 7-hour or 6-hour shift, what they go through, the amount of emotional labor that nurse undertakes every day is something very, very much we have of concern to us as leaders. Hierarchical structures. If you don't build the assertiveness in our nurses, then it's going to be, even to talk to your own ward in charges and our own shift nurses, I think our nurses will be scared of. So the approach, even if I make a mistake, I should be given the approachability to come and say that I did this mistake. Hierarchical structure should be governed in such a way that it gives an opportunity for me to be truthful and honest and practice integrity in the organization where I am. There are a lot of resource limitations which are there, and nurses have to even balance these resource limitations but provide quality of care. Burnout and attrition are very, very common in nursing. I think many countries are looking at Indian nurses because they say their nurses are undergoing this burnout, and now we want nurses to come and work there. So a lot of brain drain is happening because of that. This leads to exhaustion, and people at the end they want to quit and move to another profession. So the challenges what nurses face, or people or employee in an organization face, makes a lot of difference, and that's why compassionate leadership matters. Compassionate leadership matters because your people are going through all these challenges, and sometimes we become blind because we are running behind something which we don't know for what, but at the end you want to put in paper that the quality of care of an organization is 90%, 95% is A++. So that's a reason. So, as you had mentioned in your chat box, there are many traits of a compassionate leader, and what you told marks everything of it. A compassionate leader should know how to listen actively. If someone comes to speak to you in your cabin, or someone wants to speak to you and you are there, if you have a pen in your hand, put the pen down. If you're looking at a monitor, don't look at the monitor. Look at the person. Make an eye contact. If you're looking at the mobile or speaking in the mobile, get and hold there. Speak to your person who's come to you. Because when a person comes to you, our not only verbal communication, but non-verbal communication also should say that you are ready to listen and I am ready to connect with you and hear you. So that is empathy, and that is compassionate leadership. That is empathy. Humility is, again, I mean, that's what we have been talking about. It's a virtue which is grounded in nursing, and every human being should have humility. If we don't have humility, there are options of how to improve it, but we should know our own limitations on that ground. Acceptance is very, very important. Emotional empathy, I think something which you recognize, that you recognize the need of the other person and try to be there for their help. Kindness is, sometimes they say kindness, empathy, compassion are all the same. No, all three are different. Kindness is not empathy. Empathy is not compassion. All these three things are different. And altruism, as we said, being there for a person, being there for the person, showing that a pathway towards a solution or help is something being an altruistic person. So there are 4 very important pillars. Now, these are the qualities, but these qualities are grounded on 4 important pillars. That is all about compassionate leadership. So if as a leader, I practice these 4 pillars, or I know or understand these 4 pillars, by virtue of knowing itself, I know how to groom myself as a compassionate leader. So these 4 pillars are attending. That's the first quality we saw. Give your ears, listen to them. Not only verbally, non-verbally also we must listen to them. Understanding is a second pillar, where you know what other person needs or thinks. So that is understanding. Empathy is keep your heart in their body and their heart in your body and see how they feel. We used to say shoes, but now we say the heart, because that's what empathizing is all about. And empathizing alone doesn't end your compassionate leadership journey. Being there to help, identifying a solution, giving them a solution, giving them a resolution to the problem they are having. Probably, as we were talking about this nurse who is a novice nurse, who are doing a dressing, a person who's been first time posted in ICU independently. Before the teachers were there to supervise, but now there is no teacher. Now you have a novice nurse who's there in the ICU managing everything all alone by themselves. They need support. They need a hand holding. So that kind of helping, it is we who have to understand and do. So these are the 4 pillars: attending, understanding, empathizing, and helping. Helping is taking intelligent action to alleviate the suffering the person is going through. So there may be personal problems the person is facing, because there is a person behind a professional. There may be professional problems a person is facing. For both, nursing leaders should provide the compassionate care. So this is one scenario which I thought I can share with you. One scenario which I thought I can share with you is a distressed patient's family, about managing an anxious family. Now you must tell me, well, as I talk here, you can just give your inputs onto the chat box. So in a crowded government hospital, a patient's son is aggressively demanding immediate attention for his father, shouting at a staff nurse, Mrs. A. Now tell me, what kind of communication this nurse has to do to the patient's son? How, as a compassionate leader, you would believe that your colleague has to answer this patient's son? Okay, listen to them. Okay, showing empathy. But what would be my dialogue? What would be my dialogue? Attend the person. Okay, empathetic conversation. Okay, attend immediately. Okay, right. I'm much happy with the way you told me. But now tell me, if this is correct? So please wait your turn. For your turn, everyone is busy. Don't shout. Is this communication correct? No? Yes? No? May I help you? Can I understand you? Okay. So you, all of us know that this is not a compassionate communication, or this is not a compassionate leadership communication we expect. So what should be the communication response? Nurse Anjali takes a breath, makes eye contact, says calmly, "Sir, I can see you are very worried for your father. That is your right. I am listening. Let me quickly check his vitals right now and update you. We are on the same team." So when you say this statement, wait, don't shout, you are escalating a conflict, you're escalating a problem, you're escalating a situation. But when you use this compassionate leadership response, then you're de-escalating a situation by building trust through your eye contact, and also by the way how you are communicating that I'm here to check the vitals, we are on the same team, let's proceed to providing the care. So this would be an outcome of a compassionate leadership response. Any situation, there is a positive response which we can provide to calm a person. Now this is another interactive scenario. So you must tell me, what would you do? Which option you would choose? You are a nursing supervisor. You notice Mr. R, who's usually cheerful, has been quiet, making minor errors in medication charts and snapping at his colleagues for 2 days. What is the first compassionate action you would take? There are 4 options given. Now type the option which you would choose. What will be the option you will choose? A, B, C, or D? C? 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 So all of you are here are compassionate leaders. I'm very, very happy about understanding that what we are and where we are, our pathway or the journey, what we are traveling, we are on the right track. Kudos to each and every one of you in this virtual audience. Yes, you will pull him aside privately and check in. Say, Raj, I've noticed that you've been distracted. Is everything okay? As a leader, we are responsible for the person who's behind the professional who is there. And that is our responsibility to take care of it. How to cultivate? There are many, as I said, a research which was done, and they asked nursing leaders. And these nursing leaders, they said they need to practice. 91% of these leaders, among nearly about 700, 800 nursing leaders, they said, 91% of them said, yes, we need to practice compassionate leadership. However, 85% of them said, though we know, but we don't know how to apply it in the right situation, or we don't know how to cultivate or how to develop ourselves towards compassionate leadership. So how do we cultivate compassionate leaderships? What I might say is only few points or tips or very simple things which we can practice. But there's a whole course altogether regarding compassionate leadership which is available there. So strategies are more. A 2-minute check-in. All of us meet our colleagues. Yes. Every shift we see so many of them. You know that one of your colleagues, a family member is sick, or you know that there is something which is going on in a person who is there in your team, do a 2-minute check-in. Ask them how they feel. So a person on the other end will be feeling wanted in the organization, recognized for what they are. So the 2-minute check-in is being valued in the organization. I am being valued in an organization. That is what 2-minute check-in. So you can cultivate this as a leader. Just do this. It's a very informal thing and it's a very, very easy thing that leaders can practice. And active listening. Active listening, as I said, I gave you an example of that active listening. And always use the words positively. The intent of even if a question which we want to ask should be with a positive intent. When something has happened and that person comes to report, so why did you do that? Is asking, is not giving a space for them to answer. You're asking a question, that person will say, I did this because of this and leave. But that is not, it's not our intent. That is not a positive intent. A positive intent is giving an open-ended question to your colleague or to your nurse, junior nurse, and asking them what happened. What happened? And in a tone that will definitely give them a positive thing, that they will get an answer from you. They will get a solution from you because they believe in you, the trust they have in you. So assume always, as nursing leaders or compassionate leaders, we have to assume a positive intent in the communication than just trying to blame judgmentally on the person who comes to talk with you. And most of us don't do this. These two things, none of our nurses, even probably people used to ask how much of self-care and self-compassion we are practicing. How much of self-care and self-compassion are we practicing? So only if we are self-cared and when we feel the compassion for ourselves, can we show compassion on others. So practice self-compassion, and when you have a lot of compassion in you, you can pour it out to the others in your who are working in your teams. And voice appreciation. Most of us say excellent, good. That's very good what you did. But giving a verbal appreciation through your through the situation, what has happened. The way you calmed the patient down was incredible. You can appreciate Mrs. Anjali on that. The way you calmed the patient was incredible. The way you handled, the family, the way you communicated the message to the family is highly appreciable. So that way, we are giving them voice appreciation that recognizes the person in an organization. So that's where we feel we as a nursing leader can cultivate compassionate leadership. Is it feasible to cultivate? These are only few tips which I've given, but there are so much available. There are tips which are there, which we can practice as leaders. And I think in an organization, people are the most important. People are the most important. If you take care of them, they will take care of your goals, your organization, your targets, your vision, your mission. Believe in me. This is an experiential learning I'm sharing. And once you believe in your people, you trust your people, and you show compassion to your people, people will achieve whatever you want for the organization. So some of the key takeaways I have for you here is compassionate leadership is all about competence plus caring and the courage, the assertiveness we carry with us. It is a very critical tool in nowadays, very critical tool in retaining staff. If a staff want to do higher education, there are certain organizations which say, if you do not have this experience, we will not give you a certificate. But that is a negative way of holding the staff in an organization. But compassion will allow you, that person who goes to study higher education will come back to you to work to you for another 5-7 years. So it's a critical tool for retaining staff and improving healthcare. By itself, compassionate leadership is a cycle. The 4 pillars, I said, the 4 pillars. Attend, listen, that is, understand, feel what they feel, empathize, And definitely your final, the fourth pillar, which you have to do is help. So it starts with very, very small actions, as I said, a 2-minute quick check with the person, giving a good appreciation. You don't need to do anything very grand. You don't need to present them with a gold coin or a silver coin or a big gifts or something like that. Our nurses need appreciation, and without appreciation in today's world of information overload, of opportunities overload available for nurses, you cannot retain them. It's very, very difficult. So you need to do small gestures which will make them feel valued and recognized in an organization. So if you want to lead others with compassion, lead yourself with compassion. Self-compassion is very, very important. So I probably after this session, I'm seeing how to practice that for myself. So be the compassionate leader you want to have. Stay safe and take care of each other. Very, very important. In an organization, we matters. And I will never work. It is we matters, and we is not two of us, it is a whole team. The team matters and we matters in an organization. So you have heard the story about compassionate leadership. So what is your next move? What do you think you have to do? Few of the participants, if you would like to share, what do you think after listening to this story on compassionate leadership? What do you think you want to do when you go back? Anyone?
The participants can raise your hand who would like to know, share your thoughts on live here. So we'll
You can even put
facilitate
it on
the
the
talk.
chat box. There is no
Yeah,
issue.
even in the chat box.
On chat
Yes,
box.
yes.
Okay.
So there is one goes like,
the patient and listen. Okay, that's nice. I will keep more patience to my faculty. Excellent. That's the transformation we need. That's a transformation. Empathizing leadership. Excellent. Very, very good. We practice happy hour monthly. That's a good tip, ma'am. That's a very good tip. Okay, to keep yourself more confident, more understanding. Okay, be a good listener, to be a compassionate leader, to spend valuable time with the team. Excellent. I mean, I think something which all of us miss in this world of, as I said, the rat race, where you really want to achieve something, but we need to spend time to be a good leader. Excellent. So thank you so much. That was an overwhelming comments which I saw on the response which I saw. So you also have to build yourself. While you are a compassionate leader, we have to add the word transformational before your compassion. Transformational is taking your organization to the next level, transforming nursing care in an organization. You want to transform your the values into action and reality through compassionate leadership. So compassionate leader is important to do this transformational component. So to become a transformational compassionate leader, just start doing it. Just start, put your first step forward, and everything will come, and that's what will give us happiness. Because when you know I have made one person happy in my day, that is a satisfying day for me. As I reflect when I go to bed, we are happy, they are happy, and we are happy. That's all we want. And those are the people who will come back to you. So if you as a reader here, you ask these questions for yourself. You put a tick mark against these questions. Are employees growing and developing under your leadership? Are you deputing people for higher learning? Are they growing in their professional component? Are you providing an opportunity to explore opportunities in your specialty? Are you supporting employees when they are faced with challenges? They are in a very difficult situation. There's an inquiry in an organization. I know about so many nursing leaders who are stand by their nurses when it comes to an healthcare inquiry or a patient inquiry or a management inquiry. I've heard stories from my colleagues who are CNOs of various hospitals, how they take the pain to stand with their nurses and to say, go back, do a critical analysis, identify the pathway, identify the root cause, and see where the problem lies. And always should not be blamed on a nurse. So supporting employees are very, very important. And have you been able to express yourself to the employees compassionately? Am I able to speak to my employees compassionately? Not just saying hi, hello. That is not compassion. That is greetings. Saying hi, hello is no more compassion. It is greetings. So how do I communicate compassionately? Are you treating your employees well? Giving them respect? They might be your junior or your senior. They might be a fresher in the organization. They may be a station seniority in an organization. But all of them should be treated in a way they are feeling valued and recognized. So if you have a tick mark against these very important 4 core components, you are you can score a very high degree of compassionate leadership qualities in you. So take a minute. Now, all of you, just take a minute. Reflect on the leader who has been compassionate in your professional journey. So from your BSc nursing, from your masters, or through your post-basic nursing, or through your nursing, working as a staff nurse in a hospital, or in a educational sector, or in a primary healthcare sector. Think of a leader who has definitely showed compassion towards your professional journey. Thank them. If possible, make a call to them this evening and say thank you. And that will make a lot of difference, because that's what is reflection. Reflection should teach us into better learning and a happiest journey in the way forward. So my final take-home message to you is, make compassion default. You all have default buttons in our Android phones and your iPhones. This is default. So compassion is a mandate. That's a default. Whatever communication you make in nursing requires our nurses, our colleagues, our juniors, our students, the organizational people or employees or healthcare by itself requires compassion. So make compassion a default button for you. These are some of the references. Sow the right seed today. You role model your behavior of compassion to the younger generation. Role modeling compassion to the younger generation, that is sowing the right seed. So what you would reap when we are sick and when we go back and to the hospitals, we get that joy of being cared with compassion. So you reap and rejoice as you sow the right seed. Wishing you all a very, very happy weekend there. And this is a thank you from my family. And I can be reached out at this email ID and contact number. Thank you so much.
Thank you so much, ma'am. I could see, very impactful speech, and, there were a lot of comments running in the chat box saying you're the compassionate leader. Many followers of you are there in the participant list, I think. So they're like, you're the most compassionate. They're taking you as a role model. I don't know, like, which one I'll be highlighting from your talk, but one line which I have much impressed is about, like, don't feel for them, feel with them. That's the highlighting sentence which is
Exactly.
fixed into my mind. Yes. And very interesting session, ma'am. And true pain points have been identified where the novice nurses are ignored mostly, they are not helped out, and how the existing leaders must be there for the junior nurses. And you have given a very clear pathway to reduce the attrition rates in the hospital, because if they are following it up, everyone say handhold the nurses, handhold the newcomers. And that one storyline what you have given, like, go with the junior, help them when they are doing up, and be with them when they are in need, that is the real impactful way where we can withhold the nurses in the organization without even the attrition rates. Because I have seen many junior nurses come up and attending for the procedure, helping out the doctor. Once the scenario goes worse, the second day it's going to be attrition without even informing to the organization they're moving out. If they know someone, a leader is beside them who's going to help them throughout the path, nobody is going to run away from the organization. And you have touched the point fantastically, ma'am. Thank you so much. And I was unmute, I was like having all the emotions, everything together. I think a lot of heartings over and all the appreciations were running over the screen, if you would have noticed that. Thank you so much, ma'am. So impactful talk.
Thank you.
Yeah. So
Yeah, thank you so much, Dr. Kanchana. It was an amazing thing. And talking about compassion is not an easy task. It's such an abstract concept, but you made it so structured, and also how to do that. So I think you can go through the rest of the slides, and you'll open the thing for Q&As. Thank you so
yeah,
much.
yes, sir. Yes, sir. A very small announcement about upcoming month webinar series. So September 5th will be focusing on the theme Elevating Standards to Achieve Excellence. The topic which we are going to focus is on decoding a basic 𝐂𝐮𝐬𝐬𝐢𝐨𝐬𝐞, 5 rhythm everyone must know. And second week we are into the theme how to organize ourselves and a workplace, how to give a perfect handover. That's the topic. So we are going to focus on 𝐿 framework and a beginner guide it would be. And third week, September 19th, the theme is on learning from errors and incident reports. So this time it's about like spotting subtle signs of deterioration to prevent the cardiac arrest. And finally, the fourth week, wait for the the surprise element. We will be announcing later who will be the special guest for the upcoming month, and inspiration and insights from nursing leader as we had today. So thank you all, and we have not come to an end. We are open for all your questions, and Kanchana ma'am is here to answer you all. And sir, can I start up with the questions?
Yes, Stella, go ahead.
Yeah, yes. Meanwhile, the link is there in the chat box to obtain your certificate for the participation for this webinar. So please fill this form when this Q&A session is going on. Ma'am, there was one question.
The QR code is for what, Stella?
Yeah, sorry. This QR code is for to join in our WhatsApp group. So the participants who are yet to join our WhatsApp group, who are like to get more details about our course programs and all the webinar details, everything, you can scan this QR code and join our WhatsApp community. So this will be on the display, and your feedback link will be in the chat box. So let us proceed with the questions. So ma'am, there was one question.
Yes, dear.
Let me open up again. I'm sorry. So how to have control in evaluating the students while they're using AI to write their care plans?
Probably that's not a compassionate leadership question though. See, as I said, the communication, what you have in one-to-one, they might use the AI to write the care plans and submit to you. But when they come to you, it's all about what you ask. You ask them, you make them, the conceptual learning, if they have had, you can check. There are many ways to monitor that. So when you give an assignment, you have to check. Now you have many tools as plagiarism checks are there, you have many tools to check if these assignments are completely AI written. And so the tools, I think that digital literacy we as teachers should have, and identify those tools to check if it's a plagiarized material or a AI written material. So that way teachers can utilize those tools for identifying.
Okay. And I have taken a screenshot from the chat box because there were a lot of interactions in the chat box. So there was one question like, what are all the challenges of a compassionate leader, would you think?
Yeah. The challenges of compassionate leader is sometimes misinterpreting compassion, because there are certain things which are not compassion. There are certain things which are not compassion, like being overkind and giving a biased care, care or concern to a employee is not compassion. So there are certain things which compassion is not. So As a leader, we should know. The challenge is that identifying what is the right pathway towards a compassionate leadership and what is not. So we should, being a mature a leader, we definitely can identify that. So the challenge here is, one, when you practice, people should not take over advantage. I also saw a question. We give so much care to our students, but students don't understand. So that was one of the biggest challenge that all educational institutions are facing now. We show so much of care and concern. Sometimes over care and over concern becomes toxicity at a level, and the people don't want to listen to you at one certain point. But there should be a right mix of, giving them the space. Now, you can't take solutions for everything. It should be a solution with them, along with them, so that they are happy with the solution which they are taking, and to practice it. So that way, the challenge is to bring to that context of making them engaged in the process of identifying as well as identifying the solution.
Okay. And there is one more question, like, what if people misuse our empathy?
No, I think we are all mature leaders, and we know. See, empathy is something, once they feel, when you are there in their heart and you didn't understand, I think people who are going to show a wrong picture, their behaviors would definitely show it out to the nurses. So caring, compassion should not be misused with over advantage of what people will take. So thinking that they will misuse, you don't even show empathy to nurses or to your own people. I think that is where the problem starts off with. So don't doubt it. Don't doubt the process. But you should know when the person is not in track. When you know that, and always don't fall for a person. No, you should be there when they require, not all the time being there with them. So it is a need where you have to identify and provide a solution, but not all the time providing solutions for them. So that is not what compassionate leadership is all about.
Okay. And one personal question, I think so, is like,
Yes.
as you mentioned that your sister in CMC is your role model, please may I know her name?
Who?
Like Miss Uma Maheshwari,
Her
madam
name
have
is
asked.
𝐶 Nirmala. She is an infection control nurse and a quality manager at Behrin now.
Okay. Okay. Thank you so much, ma'am. Thank you so much for all your patience, answering for all the questions. And it was a great session for all of us, ma'am. And so from your side,
I have nothing more to add. I think it was a amazing learning experience for all of us. Thank you so much, Dr. Kanchana, for his insightful lecture. And I think a lesson in compassion from a compassionate leader. I think that sums up the whole session.
yes.
Thank you, sir. I mean,
Yes.
Parisat, at this level of achievement, what sir has, the humbleness he carries with him. No, when I was in charge at Omayal Achi Community Health Center, I used to be awed by the way how he communicates, and the respect what he gives for the nurses who are with them, who's working as a team. So even when we go back to Sundar Medical Foundation, I have heard a lot of stories about sirs and team of people who work with sir. But even at this level today, the way how he communicates, the humbleness, the soft-spoken nature, I think, and the concern he has for nurses, and today all of Skills for Med, what he is doing for nurses, I think, sir, thank you so much for being there for our professional people.
Thank
And we are blessed and humbled by the gesture what you are showing for nurses.
Thank you. I just wanted to share one incident which happened in the theater yesterday.
Yes, sir.
Just to show, how much the nurses have to take this as their own, something which they have to do themselves. I mean, we can do all the skill swimmer and all this stuff, but unless the, nurses take them. So I was operating, and my PG was assisting me, and PG was very over enthusiastic to assist me. So I think, Stella, you will understand this more because you have been a theater nurse as well. So when I asked for an instrument, my assistant took the instrument from the tray and started giving it to me. And the nurse was keeping quiet. I mean, I have
As
experienced.
if I were, I'm sorry to interrupt, sir. If I was that such scrub nurse, I would have hold his hand. Do not touch my trolley.
Yeah. So the nurse, the scrub nurses, no, I don't know, the training has to be given that there is a certain territory which the scrub nurse, it's a very sacred thing, no, because as a surgeon, I understand that, and having worked in UK also, no, I know how empowered the nurses are. If you have done that in the UK, as Stella said, they would have just, put my hand away. But here the nurses are not doing that. No, this is actually a brother, a male nurse who was my assistant. So I was telling him, no, you've got to have that, empowerment and the assertiveness to say that. You don't need to be nasty, but you can say very nicely that, doctor, please don't, do that. I will give the instruments to the surgeon. So, that was an important lesson, not only to the nurse, but also to my assistant. I didn't actually reprimand my assistant, but I just told the nurse, this is what you got to do. So, this is an example of how much our nurses have to wake up. That is something I'm seeing. They're all very comfortable in this state where they just have to come, do the work, and go. But they need to have the desire to get empowered. So I think that is something which I think colleges like yours are doing, but there are many other colleges, unfortunately, which don't instill that in the nurses.
Yes. I think that's the ground level thing we have to, sir. Allow them to ask questions from the very first year, making them empowered to ask questions, to critically think and be assertive. I think education institution have to take that baton in their hand to see that they develop that in the students. Only then we can see that change in the service sector or anywhere otherwise in nursing profession.
Yeah, that's
Yeah,
great.
I
Sorry,
got
just
this.
want to add it.
I got this about this, theta ethics and territory training from my initial, start of career in Chennai, in India, in Chennai. And my mentor was nowhere. She didn't work in abroad anywhere. She was trained in Chennai, and she the one who, trained me. Being a role model, she taught me how to be very bold enough to tell, like, which is which is your boundary, where no doctor should not come. You have been how to be like, also to how to communicate with the doctor when they're coming up, touching your trolley, how to tell them, like, doctor, I could give you pass the instrument, whatever you want, just ask me, I'll just pass the instrument. So that's how, like, things I have learned. So I think this is the moment I am so grateful to her. My mentor was there in Apollo Hospital who taught me all these things. Yes. Thank you so much, sir, and thank you so much. And as Dr. Pari have mentioned, all the nurses have to be like very assertive and bold enough to face the situations and speak up. Speak up, all my dears. Like speak up in your environment and be skillful to speak up things in a very clear way. So that's very important. Upskilling yourself, and then with your knowledge and confidence, walking in your career, it's very important, which gives you bold assertives together. It comes up in your path. So thank you so much, sir, and thank you so much, ma'am, and thank you to all the participants who are still on here, like listening to our webinar. I don't think so anybody have moved, like still they are like awake listening to us. Thank you to everyone, and ma'am and sir, you can take a leave. So this will be on for some time. Let the participant fill the form and and then they can leave the Zoom room slowly.
Thank you,
Thank
sir.
you. Thank you so much. Thank you. Bye.
Excellent facilitation. Thank you.
Thank you, ma'am.